If you have leg lymphedema, keep watching this video as I guide you through an updated and modified manual lymphatic drainage routine for leg lymphedema. This is based on some newer research and what I've seen to be helpful in the clinic. I'm Dr. Alex Hill, and I'm a double board certified physical therapist. I specialize in pelvic health, oncology, and lymphedema, and I'm really excited to show you this updated sequence. So if you're looking for that updated sequence, keep watching this video. But if you're looking for the tried and true and traditional manual lymphatic drainage, especially if you have more severe lymphedema, you can find the link to that in the description below. Research findings from the ALERT program indicate that lymphatic uptake, so the fluid getting back into the system during MLD, is actually highest in the lymph nodes in the same side of the affected leg in that groin, followed by fluid being taken back in the groin on the other side, and then behind the knee, and then finally the gluteal area. Importantly, it seems that there's very minimal fluid that goes up the side of the trunk to the lymph nodes in that armpit. And this is really where the difference lies from the traditional MLD versus the new MLD. So with this new sequence, we are actually not moving that fluid up the trunk. We're only going to be focusing on moving it to the same side lymph nodes in the groin, the lymph nodes in the opposite groin, and into the glutes and behind the knee. Now, this exciting research is still relatively new, and the research findings were based on each person's individual lymphatic anatomy using a specialized type of imaging called ICG imaging. Many clinics don't have access to that type of imaging, but we can still utilize the findings in these studies to help guide adjustments for MLD to improve efficiency, especially when time is limited because these are a little bit shorter, and for creating an MLD that's easier for you to stay consistent with. Now, a couple safety tips. As always, check with your own certified lymphedema therapist first before changing any part of your program. And while you are doing the MLD, make sure that if you feel short of breath, chest pain, you feel heart palpitations or your heart's fluttering, or something just doesn't feel right or seem right, stop doing the MLD immediately and contact your medical provider. All right, let's get into that new sequence. I'm going to be showing you this MLD routine while sitting on a recliner, but you can also do this in bed, and you can have pillows or folded blankets ready to help support your legs up as you're doing this routine. Regardless of what side the swelling is on your legs, we're always starting in the belly first. This is our central lymphatic system where most of our lymph nodes and our lymph vessels are. So this is where we're always going to start. So you're going to have your hands over your belly button, and you're going to breathe in through the nose and out through the mouth. If you don't have any pain as you press into the abdomen, then you're going to press in as you breathe out. Otherwise, if you're not comfortable with pressing in, if you are pregnant, or if you're not able to press into your abdomen, just doing the deep breathing is still going to be helpful. So go ahead, hands on your belly button. You're going to breathe in through the nose and out through the mouth. As you breathe out, you're pressing in. We'll do that 2 more times. Breathe in and out. And 1 more time. Breathe in and breathe out. We're also going to do that same breathing and pressure in 4 quadrants in our abdomen. So we're going to start on the left lower part of your abdomen, just above the pelvis. And you're going to again breathe in, breathe out as you press in. Nice, long, slow breaths. We'll go to the opposite side. On the right side, breathe in, breathe out as you press in. We're going to the right upper quadrant, so right below the ribs. You don't want to be pressing on the ribs. Breathe in and breathe out. And the last place, left upper belly, breathe in and breathe out. If you have pelvic or genital or trunk lymphedema, I encourage you to do that breathing sequence 1 or 2 more times to really get that central lymphatic system moving. But otherwise, if you have mild to moderate swelling and it's mostly just in the legs, then that 1 round of breathing is perfectly sufficient. So again, the old traditional way of doing MLD is moving the fluid up the side of the trunk, but we are focusing on moving the fluid to the groins as well as behind the knee and in the glute area where most of that fluid is taken back up. With this sequence, I'm going to be showing you it on my right leg, but if you have swelling on the left leg or on both legs, then I'll talk you through those modifications as we go. So the first thing that we're going to do after we finish the abdominal sequence is we're going to stimulate the lymph nodes in both groins, regardless if you have swelling in one or both legs. So you can either do this with both hands at one groin, or you can do both hands at each respective groin, whatever feels most comfortable for you. I'm showing you in standing first so you can see where my hands are at in the movement. You're doing it at the hip crease, kind of at the underwear line here, and you're doing 5 to 8 circles at each of those groin. You can also do 1 at a time if you need help with a little bit extra pressure from the other hand, and you're going to do both sides, but I'll also show you sitting. And so you're going to just take both hands and you're going to, again, massage in that circular fashion. And we're doing that at least 5 to 8 times on each side. And again, you can do both at the same time. Again, if you have a lot of swelling or you have more severe swelling, then make sure that you're spending extra time at the groin. If you have swelling in the trunk, abdomen, or the pelvic region, or into both legs, you're going to move that fluid to their respective sides. If you only have swelling in one leg, so for example, the right leg, you'll be moving that fluid up to that side, and you're going to be moving it across to the other side. So I'll be showing you this sequence for swelling on just the right leg. And so you're going to start by massaging from the abdomen, and you're going to be moving it kind of in a rainbow pattern from midline down to the lymph nodes in that groin. So you're gonna do that 5 to 8 times, and again, you're just moving that lymphatic fluid over to the lymph nodes in that groin. And you can also work on the side and bring that fluid forward into the groin as well. And then you're also going to move that fluid across the abdomen and over to the other side. Again, this is primarily if you have swelling on just one side, and we're going to utilize the lymph nodes on that other side. This is pretty low. This is right above the pubic bone. So your hand should be between the belly button and your pubic bone, and you're moving that fluid over. Every single movement should be on the skin, so directly on the skin itself, not over clothes. And we're doing each of these movements for 5 to 8 times at least. Spend extra time if you have more swelling. After we've started to move that fluid in the lower abdominal area, now we're going to start moving that fluid from the upper thigh. So again, all of this is going to be skin on skin. And so what you're going to do is taking your hands with fingers together, you're going to slowly give moderate pressure, and you're almost kind of sweeping or pumping that fluid up the leg and to the groin. The key here is to make sure that you're doing moderate pressure, you're doing slow movements, and you're moving it up towards the groin. My hand placement is like this, bringing it up, but you can also kind of stack them like this if that's easier for you to move and to get that swelling out of that area. So this is working kind of the front and the sides of the thigh. You can also, as you can see here, use a folded blanket or a folded pillow and bring that leg up, so you're also having some assistance from gravity with helping to move that fluid. And you can spend extra time anywhere that you have more swelling or that you have fibrosis. And again, we're moving that fluid up to the groin. This is the primary area where that fluid is going to be taken back up into the system on that side. After you've worked on the front and sides of the thigh, then you're going to start working on the back of the thigh. So you can either bend your leg up like this using that pillow or folded blanket to support. You can also fold it up over the other leg if that feels better and easier to reach. But whatever works for you to get into the back part of that thigh. So I'm going to change my position so you can see a little bit better here. And so from the back of the thigh, we're moving that up to the glute, where a lot of that fluid is also going to get back into the system. So you're still taking your fingers together behind the thigh, and you're bringing that fluid up and out to that glute. So again, bringing it up, nice slow pressure, skin on skin, and bring it up to the glute. So you're going to be doing multiple pumps up the back of the thigh, and this is what you're going to be doing for that 5 to 8 times as you bring that fluid up. It's not uncommon to have a lot of fibrosis and firmness, especially at the back of the leg, lower leg, and the knee. So if you need to spend a little bit extra time with some deeper fibrotic work, you can do that. Make sure that you do any deeper work or work on fibrosis before you do this manual lymphatic drainage. This is going to help move any excess inflammation and swelling that happened from your fibrotic work. So this is going to help make sure we get everything out of that area. So again, 5 to 8 times as you move up the back of the thigh, moving it to the glute. And we're just slowly working. We want to make sure that all of our movements are intentional. We want slow movements. We want moderate pressure. That's another change that we've learned over the years is historically we have done very light pressure, but there's research that shows that we actually can get better lymphatic flow if we use deeper pressure, more moderate pressure. So now that we've got the front of the thigh, we've got the sides of the thigh, so outer and inner, bringing them up. We've got the back of the thigh. Now it's time to do the knee. From the research, we know that a lot of fluid is going to get taken up also into the knee. So you're going to bring your fingers together. You're going to kind of cup them, and the movement is bringing it up towards you, kind of, again, like a rainbow. We've got a lot of rainbows in this sequence. So right below the knee and into the space there, you're going to be bringing that fluid up. So all of my pressure is in my fingers. I'll bring my leg up so you can see a little bit better here. So bringing it up like this. And again, 5 to 8 times at least. You can definitely spend more time here at the knee if you have more swelling. And then after we do the back of the knee, then we're going to do the sides and the top of the knee. So I'm going to change my position just so you can see a little bit better. So we are making sure that we're covering the sides and the front of the knee, and you're bringing that up. If you have a hard time with that, you can always do just one side or one hand at a time. But again, we want to make sure that you are working all parts of the knee and bringing that fluid up. And again, we tend to get a bottleneck here at the knee, so a lot of people have extra swelling, especially at the inner part of the knee. And so you can spend extra time here at the knee if you need to. Once you've done at least 5 to 8 times at the knee, then we're going to start to move up the calf. And so again, if you have a bolster, that would be great because then you can elevate your leg even higher. Otherwise, just using a folded blanket or having it resting on your couch or your bed, or you can even fold it up over the other leg as well. That's okay. I'm going to show it to you with my leg resting up here. And if you can reach forward, then you're going to be going from the ankle and you're going to start to pump and move that fluid up the calf. And so you can see my hands are, again, fingers together, and we're working all parts of the front of the leg and the sides of the leg. And again, you're going from the ankle and you're going up to the knee. Everything's 5 to 8 times. We want that nice moderate pressure. And keeping our fingers together. We don't want them separated because then you're going to be losing some areas. We want this as efficient as we can. And then after the 5 to 8 times at the front of the lower leg, then you can do the back of the calf. So you're pulling it up like this. Again, we have a lot of fluid uptake that is at the back of the knee. So you're directing that fluid to the back of the knee. Again, moderate pressure, slow movements, making sure all areas of that leg are getting massaged. Help make sure we get all of that fluid out. And as you're doing this lymphatic massage, make sure you're continuing to do that deep breathing. That's going to continue to help stimulate that central lymphatic system as you're working on the legs. And then once you've done 5 to 8 times going up the calf, again, you can spend extra time there if you need it, then you're going to start to work on the ankle. So at the ankle, you're going to take both hands inside and outside part of the ankle, and you're going to bring that up. So more like a J versus a rainbow. If you go like this and you do a circle, then there's a potential you could just move that fluid down. So we always want to bring that fluid up. You can kind of cup a little bit more behind the ankle bone because some fluid likes to pocket there. And so you're just scooping up at the ankle, and you can use your thumbs at the front of the ankle at least 5 to 8 times. And then you're going to work on the foot. And so for the foot, you're just sweeping up like this. And if you can't reach the foot, that's okay. You can always use an extra tool like a mini paintbrush roller or a dry brush to sweep that leg and sweep the lower part of your leg and your foot. If you have a hard time reaching or if you don't have anyone at home. But the good thing is with the research, it shows that even if you just work the upper part of the leg, the lower part of the leg and the foot can still have some benefit from it. After you're done with the foot, then you can go to the toes. So if you don't have a lot of swelling at the toes, then you can just kind of pocket them between your hands and move this way. But otherwise, if you do have swelling at the toes, then you can massage each toe individually and get the swelling out that way. And again, you can spend at least 5 to 8 times at each of the toes. And again, if you can't reach down here, that's okay. If you can't do each one individually, that's okay. Just do what you can. And again, you can still always just use your whole hand to massage the toes. Once we get all the way down to the bottom, then we're gonna work our way all the way back up, but we're not doing those at least 5 to 8 times. We're just doing it 2 to 3 times. So we've got 2 to 3 times at the toes, 2 to 3 times at the foot, and then we've got the ankle. We've got the back of the calf. We've got the front of the lower leg, and then again, you can have your bolster, your folded blanket here to help with gravity. So we're bringing that fluid up. Again, we're working the back of the knee since we know that a lot of fluid comes up that way. We're working the sides and the front of the knee 2 to 3 times. We've got the back of the thigh, bringing that up and out to the glute area here. Think of it like almost like your back pocket that you're moving that fluid to. And then finally, we've got the front and the sides of the leg, and we're bringing that up to the groin. And we'll do one more here, really get that fluid up. And then if you need to, then you can also move that fluid across the lower abdomen and help to get that fluid out if you have a lot of swelling on that right side or on that affected side. And then the last thing we do at the end of every lymphatic massage is we do a couple more deep breaths. We'll do 3 breaths here. Go ahead, breathe in through the nose, out through the mouth, and press in. Breathe in through the nose and out through the mouth. And one more. All right, I hope that you found this video helpful in guiding you through these updated MLD sequence for manual lymphatic drainage for the leg. If you found it helpful, please give it a thumbs up. Make sure you subscribe to my channel for more videos on lymphedema content, and share this video with those who would benefit from learning about this updated sequence.